The following information is brought to you by the Missouri Alzheimer's and Dementia Program. Scan the QR code for details on the Dementia and Alzheimer's Patient Resource Toolkit and empower your patients on their journey.
As a healthcare provider, you and your staff are uniquely positioned as the first line of information for your patients who are newly diagnosed with Alzheimer's or dementia. Approximately 70% of people living with dementia live in the community, with 1 in 4 living alone. This makes information on access to community services a critical piece of their care. Public and private agencies, including the Alzheimer's Association, area agencies on aging, memory care home solutions, and other state programs have been working with the aging population and people living with dementia for decades. Statewide efforts from these agencies and many more help connect patients and caregivers to respite services, financial assistance, nutrition programs, safety recommendations, and much more. The public health approach focuses on improving the health of entire populations across the lifespan, including dementia risk reduction, early detection and diagnosis, prevention and management of other health conditions, community clinical linkages, and referrals to services and caregiving for persons with dementia. Perhaps more importantly, this approach helps to build coordinated systems that combine efforts for dementia and caregiving. But what does that mean, and why is it important? Community clinical linkage leverages established relationships and new partnerships between public health, community organizations, and healthcare systems to identify community resources, gaps in care, and action steps for patients diagnosed with dementia and their caregivers. These linkages improve access to valuable programs and services and are key to accelerating progress in brain health across the life course. They also offer opportunities to address social drivers of health from different angles. Often, providers like you diagnose a patient. They're scared and overwhelmed, and there is a lot of information to sift through and process. You want to help your patients and their caregivers be prepared for their next appointment, but not all information they'll find on their own will be legitimate or relevant. The Dementia and Alzheimer's Patient Resource Toolkit is a collaboration of the Missouri Department of Health and Senior Services and its statewide partners in an effort to create community clinical linkage and access patients directly. It is an easy-to-distribute solution that enhances a patient's understanding of the disease, as well as their ability to access services in their communities. This toolkit includes local, state, and national resources from the Centers for Disease Control and Prevention, the National Institute on Health, the Alzheimer's Association, and the Missouri Department of Health and Senior Services and their Missouri contractors to help empower your patients on their journey. It covers topics ranging from understanding Alzheimer's and dementia to next steps after diagnosis, as well as finances and caregiving. By taking a whole community approach towards dementia detection, we can build and sustain entire communities that are age and dementia friendly. Help prepare your patients for the next steps they face by equipping them with the Dementia and Alzheimer's Patient Resource Toolkit. If you have any questions, contact the Missouri Department of Health and Senior Services at 573-522-2806